Managing blood sugar requires a stable environment for insulin to function. By precisely regulating the timing and volume of your water intake, you can reduce cellular resistance, a process that clinical studies have shown improves insulin sensitivity by as much as 40%. After age 60, a specific physiological change occurs that makes controlling blood sugar much harder. Your brain's thirst mechanism becomes significantly less sensitive. Thirst is not an early warning system, it is a late-stage alarm bell. By the time your mouth actually feels dry, your body is already dehydrated at the cellular level. Even being just 2% below optimal hydration can raise your blood sugar by 10 to 15 points. This hydration strategy is a supportive measure and does not replace your current medication. If you have kidney disease or take blood pressure medication, consult your doctor before making these changes, as increased hydration can naturally lower your blood pressure and may require professional dosage adjustments. Stabilizing those unpredictable morning spikes requires a precise hydration routine. By strategically pacing your water intake, you create the exact biological environment your available insulin needs to function efficiently. Let's look at the formula to calculate your exact daily baseline. Take your current body weight in pounds and divide that number by 2. That resulting number is your daily target in ounces. For a 160-pound person, that means 80 ounces of water a day. The easiest way to execute this is to get a standard 24-ounce reusable bottle and fill it completely 3 times throughout the day, once in the morning, once at midday, and once in the afternoon. This diagram illustrates exactly what happens inside your bloodstream. Think of your blood as a river carrying glucose to your cells. When you are dehydrated, that river becomes thick and sluggish. Glucose gets stuck and accumulates in your bloodstream. When the river is full, the glucose flows smoothly to exactly where it needs to go for energy. But you cannot simply drink all your daily water at once. Your body has a strict biological speed limit. You can only absorb approximately 250 milliliters, about 1 cup, every 15 minutes. Anything beyond that volume passes straight to your bladder without actually hydrating your cells. Pacing your water intake throughout the day is the only physical mechanism that transports glucose out of your blood and into your cells, rather than leaving it to back up into your bloodstream. Step 1 of the daily routine is the morning primer. The absolute moment you wake up, before you check your phone or make coffee, drink exactly 350 milliliters of warm water. That is about 12 ounces. You must do this at least 20 minutes before your first meal. You will add the juice of half a fresh lemon and a genuinely tiny pinch of unrefined sea salt or Himalayan pig salt to this water. Look at this image. We mean just enough to fit on the tip of a butter knife. After 8 hours of sleep, your body is completely depleted of electrolytes. Pure water alone will pass right through you. That small amount of salt provides the sodium, potassium, and magnesium your cells require to actually absorb and utilize the liquid. This exact combination of hydration and lemon also signals your adrenal glands to calm down. Every morning, your body produces cortisol, a stress hormone that instructs your liver to release stored glucose into your blood. Hydrating with these minerals physically stops that unnecessary glucose dump. By properly rehydrating your cells and halting the liver's glucose release, you build a physiological block against high morning readings. You neutralize the spike before it ever begins. The next step is your pre-meal routine. Drink exactly 1 cup, between 150 and 200 milliliters, of room temperature water 15 minutes before you eat lunch, and again 15 minutes before dinner. Notice that we specify room temperature water. Watch how this blood vessel reacts to cold temperatures, shrinking and tightening its walls. Ice-cold water forces your blood vessels to constrict, making it significantly harder for insulin to circulate and reach your cells. Room temperature water keeps your blood vessels naturally dilated. Drinking it 15 minutes before a meal slightly dilutes your stomach contents, which directly slows down how rapidly carbohydrates break down and enter your bloodstream. If you are walking, gardening, or doing household chores for more than 20 minutes, you must adjust your intake. Drink 100 to 120 milliliters of water every 15 minutes during the physical activity. Do not wait until afterward when your blood volume has already dropped. By maintaining relaxed blood vessels and slowing carbohydrate absorption, your blood sugar rises gently and steadily after a meal. Your available insulin can easily keep pace with the demand. The final daily step happens exactly 1 hour before bed. Drink 1 small glass of warm water mixed with 200 milligrams of magnesium citrate or magnesium glycinate. Magnesium is a required mineral for proper insulin function, and most adults over 60 are clinically deficient. Taking it before sleep helps your muscles relax for deeper rest while keeping your blood sugar stable throughout the entire night. This chart shows the most accurate way to verify your daily hydration. You want your urine to fall into the pale yellow zone. If it is completely clear, you are overhydrated and losing electrolytes. If it is dark amber, your cells are dehydrated. By checking your body's output against this visual baseline, you stop guessing. You turn your daily water intake into trackable, actionable data. When you start this routine, expect an adjustment period. During the first week, you will likely need to use the bathroom more frequently. This is a normal, temporary adaptation as your body processes the proper fluid levels. By the second week, you will start seeing measurable changes. Your morning blood sugar readings should drop by 10 to 15 points on average. You will also notice noticeably clearer thinking and a steady energy level, completely avoiding that sharp afternoon crash. We challenge you to follow this exact method for the next 14 days. Drink your morning primer, time your pre-meal water, pace your daily intake, and take your evening magnesium. Track your numbers diligently with your glucose meter every single day. If you take this challenge, scroll down and comment "I watched till the end," and share your starting morning numbers too. Doing so holds you accountable and ensures this information reaches others who need it. Properly timed hydration establishes the physiological baseline your body needs to process glucose. It provides the exact fluid volume required for your cells and medications to operate with absolute maximum efficiency.